Hello and welcome back to Season 2 of Fertility Talks, the Therapie Fertility podcast. I'm your host, Ranae von Meding, and I'm so excited to be back hosting our second season of this podcast, bringing you honest conversation about infertility and fertility treatment in Ireland. Each week, I'll be sitting down with a different guest and chatting all things fertility. As always, our hope through this series is that through honest conversation and information, we can strip away some of the stigma that sometimes comes hand in hand with infertility and fertility treatment. This week, I'm very excited to say that we have a very special guest with us in studio to talk about her egg freezing journey. Welcome, Michelle.
Hi, thank you for having me.
Thank you for being here. So let's introduce you to our listeners. Tell us a bit about yourself. Where are you from?
So I'm Michelle. I'm from Westmeath, but I actually live in London. I am 34 in April, terrifying. And I'm just so excited to have gone through the journey, and hopefully then by sharing it with everybody today, it'll kind of bring awareness and make people bite the bullet and just go for it.
Well, it's amazing that you're talking about it, because I think there's nothing more helpful than someone actually talking about their own experience.
Absolutely.
And talking to someone who's kind of been through it. So it's really great to have you here today, and I really appreciate you being so honest and open about your journey through egg freezing. So tell us, what is your job?
So I actually work for Therapy Clinic. I head up the operations for the UK side of our business. So I've been with Therapy for 9 years, and we're in a massive expansion over in the UK. So loving what I do.
So you're busy. You're
really
busy on a day-to-day basis.
Happily busy. Love being busy.
So now is not a good time for you to talk about maybe expanding your family and having kids. Is that right to say?
Yeah, to be honest, I'm kids obsessed. I think we need to get that I'm absolutely kids obsessed. I definitely will have kids, not just I want to have kids. I absolutely will have kids, but somehow I blinked and I'm 33. I don't know how it happened. I was 21 yesterday and I blinked and I'm 33. And one thing that I absolutely hate is in this background, you've got like a tick-tock, tick-tock. And you hear a lot of people, well, definitely I know a lot of my mates, a lot of my friends, they're getting to that age where they're like, oh, I have to have kids, or, I have to make a decision, like, do I keep going on my career journey or do I stop and I have kids? And I just hate that. I hated that. I don't think there should be any pressure at all.
But there definitely is pressure. And I think, this is generalization, but more so for women because, as you reach your mid 30s, it is just a fact that egg quality and quantity does decline very steadily in your mid 30s. So that's usually the age at which women generally are like.
But don't they say from 35 onwards, you're classified as a geriatric mum?
Oh, yeah.
Even that in itself, that really infuriates me, and as you say, one thing that there's not enough awareness of is, the egg quality and egg quantity, and every single year that goes by, both your quality and your quantity reduce.
And that happens from forever,
exactly.
but it like rapidly increases.
Yeah, once you get into your 30s, the lovely 30s. But it's something that I just don't want to have that pressure. So for me, 90% of my mates, they're all yummy mummies of 1, 2, 3, 4 kids, and they're so happy. But they never were obsessed with their career. And I count myself really lucky that I don't look at my job as a job. It's a vocation. I love what I do. And right now, where I'm at, to think to stop that, it's not the right time for me. I love kids, but I do not want to have kids right now. I love my life. I love the journey that I'm on. And if I got to my late 30s and, I really was like, right, at least now by going through this process, I have that security. I have my 33-year-old gorgeous healthy eggs, and they're on ice. My eggs are on ice at the minute, and it just means that I've given myself a safety blanket and I can choose what I want to do with my 30s instead of feeling like I'm pressured to say, okay, stop everything, have kids because you're getting at that age. I don't think that's fair.
And I think it's really important for people listening to know that this is not an insurance policy.
No,
because sometimes people think like, oh yeah, sure, you freeze your eggs, and then if you run into trouble conceiving naturally, you'll have no bother. You can do IVF with those frozen eggs. Yeah. And that's not the case.
No, because actually, so once you freeze the eggs, like we have to remember, like anything, those eggs have to be thawed out. So whenever somebody decides to use those eggs, if they decide to use them, I may never use these eggs, but if I did decide to use them, the number that I got will reduce at each stage of kind of like the thawing out process. Then, you have to fertilize that, create an embryo, then that embryo has to be successful. Then you have to do the transfer. The transfer has to work. So by no means is it an insurance policy, but it's a peace of mind to know that I have a number of eggs there that will give me a good chance that two things, I can choose to use them in my later 30s. I could use a sperm donor, like if I haven't found the perfect partner, which doesn't bother me. Again, that doesn't faze me at all. Or let's say I find the perfect partner. I go forward. I have a child. By the time I want to give that child a sibling, I'm at an age now where that might be difficult. So I've also got some sort of opportunity where I could use those eggs for siblings. Yeah. So there's just so many options that you can do. But again, it's not guaranteed, but it does give you more.
It's kind of doing something instead of doing nothing.
Exactly. Be proactive about it. You know, I've taken that TikTok clock away, and that's so important.
And I suppose it's not for everyone, because some people, like, you could have come in and talked about your chances, how successful that cycle would be, and then kind of decided with the options that would give me, actually maybe it would be time to actually think very seriously about when I want to have kids. So for some people, they might come in to talk about egg freezing and then be like, actually maybe now is the time to put that career on hold. But obviously for you, this was the right thing to do, and it's going to be different for every person.
Exactly. And that's one thing I actually loved about the process. So when I went in for my consultation, bear in mind that I knew nothing about egg freezing until we opened Thérapie Fertility. So knowing nothing about it, like I'd seen it probably like in movies and things like that. Definitely my friends were all inquiring once I decided to do it, but they never talked about it. They never looked into it. So when I decided, right, okay, that's something I'm really, really interested in because of where I am in my life, I went for the consultation, and the first thing that the head nurse did was actually find out why I was here. It wasn't like, okay, you're here, you're having it done. It was very much, is this the right thing for you? Are you in the right time of life? Are you in the right frame of mind? What do you hope to gain from this? And I think that's a lovely way to approach it, because, I walked away with different questions. So when I made the decision to have this done, I was 100% confident. I knew that I had researched it, I had thought about it, and the guys, they just made me feel so comfortable, but they really did care about why I was there first and foremost.
Yeah. Okay. So when you decided that you were going to go for it, what did that look like? How long did it take? And how was that process?
It actually took me, like I did my consultation, I'm going to say the end of August. And it wasn't until the end of November that I really, that I booked it, So I had decided probably in like October, I was definitely going to do it. But again, been busy in London, actually getting around to make that call and make that booking. So August was the first consultation, and then I made the booking in November, and I started the process on New Year's Eve. So it was about 3 or 4 months, but again, there was no pressure. There was no one ringing saying, oh, we did a consult, like, are you ready to go? It was so professional, because it's a medical treatment, and the guys just want to make sure if you do go ahead with this, that it's your decision. About 3 or 4 months for me.
So you had the initial investigations. What did that look like? Scans, bloods?
Yeah, all of the above. The first,
and I know you don't like needles.
I am terrified of needles. For a woman who gets Botox every few months, I'm terrified of needles. But I went for the consultation, and on the very first day I had my bloods done just to check, obviously, that everything was okay. I had an internal scan just to actually see how was the womb, the ovaries, how was everything looking.
Was that the first time you've ever had one of those?
No, actually. I have PCOS, I have polycystic ovaries, and my polycystic ovaries, the cysts actually, they rupture. So once or twice a year I will have a ruptured cyst. So obviously years ago when this started, when I was 19, they didn't have a clue what was happening to me. So I had many laparoscopies, which is keyhole surgery, taking away cysts on the ovaries, and many internal ultrasounds. So I guess for me, it was something I was used to. But again, I'm sure there's a lot of people that may go for this process that's their first time. but it is super, super easy. Like it is. It's a really easy process.
And they really put you at ease, don't they? The nurses.
Like they're trained, honestly. Like I know that they're all trained, don't get me wrong, to have good bedside manner, but it's like they're trained how to relax you.
Yeah.
The minute you walk in, everybody, I think you walk in, you get such a family feel. That's one thing that I really felt from the whole process. But yeah, like the scan was so quick. What I love, and I don't know, because obviously I've never had fertility treatment like this before, but you see everything. You know, you're lying there having the scan with this massive TV in front of you, is what I call it. And like the guys, they got to show me like the lining of my womb, and this is what my ovaries were. And it's, I don't know, I just find it absolutely fascinating. Like, so it's almost like an education piece while you're having the scan done, which I loved. So then there's a portal that you're registered on with Thérapie Fertility, and every single thing they go through with you in the consultation. And for me, this is really important. Every single thing they go through with you, they follow up in the portal, because I'm a goose. Like I will forget everything.
You'll be nodding along like no problem. Yeah. And then afterwards you're like, I have no idea what she just said to me.
Literally to a T. And so when I actually went home, so I had my scans, I had my blood, I had my information. They, you know, made sure it was the right thing for me. Explained again, it's not insurance, you know, it's a safety net about the thawing out process, and you know, if I decide to use them. So when I went home that evening, you know, my mum was like, so, you know, how did you get on? What did they say? And I was like, oh my God.
Don't remember.
Hold on one moment. So when I went onto the portal, every single thing that was discussed with me was there. A couple of days later, my bloods were there. The pictures of my scan were there.
Yeah.
And also there's loads of resources as well so that you can educate yourself. So I
you
found
can go on
really
and
helpful.
watch videos and
super helpful. So not only are the guys great, but the actual resources that you have post consultation to really back up your decision is all readily available. And I thought that was actually really good as well. Yeah.
Let's circle back to the PCOS that you mentioned. Was that another factor in kind of deciding to do this?
For sure. That was definitely a big factor for me. I think like any normal lady who's probably at my age has thought about this if they're in the same frame of mind. But what heightened it for me was anybody with PCOS, they're not saying it's guaranteed, but there's a risk that, you know, your quality and your quantity of your eggs can reduce that bit faster. So both like career and life factors, and then PCOS on top of it. That's why it probably became such a no-brainer. If I wasn't running around London loving life for 3 or 4 months, I probably would have done it a month later. I probably wouldn't have even waited that long. Yeah. So PCOS definitely was a big factor. Definitely a big factor for me, yeah.
Okay. Let's go back to the actual process. So once you decided you were going to do it in December, how did you get your medication, your prescription that was given to you?
Yeah? Actually, good question, because that terrified me. So bringing it back to me being terrified about needles, Grania, who obviously heads up fertility, the one thing I asked her at the start, and I was like, am I going to have to inject myself?
Were you hoping that a nurse would come out to your house every day?
I was
and
just
do it
hoping
for you?
she'd say, no, you just take a tablet. But obviously you do, which is fine. It's called subcutaneous injections. Yeah. So they are really, really, really fine needles that you inject just into your tummy. So you just squeeze a little bit of the fat on your tummy and you just inject there. But when I went up, it was New Year's Eve, and I got my prescription. I was going ahead with it. And
from your own pharmacy?
Yes. Yeah. Your prescription is sent to a pharmacy and you pick it up. It was a full bag. It was
Were you like, what?
Yeah, like,
do I do with all of this?
Literally, it was a Boots carrier bag, and it was just full of boxes. And I was like, how am I going to inject that many? But because you don't know how many days in total, you could be injected for 2 weeks or 10 days.
And sometimes the medication is adjusted in the middle of the cycle, so you might need more, you might need less.
Exactly. Yeah. So they give you more than you need. So that was pretty daunting. And then again, being a goose and a featherhead, I came home with this bag going, oh my God, they told me what I need to do with this, and I don't know what I need to do with it.
So you're like, portal.
Literally, I was like, portal. So I went in, and as the guys do, every single thing step by step. But not only do they have the step by step written down for you, they tell you then which video to go into. So depending on the medication you need to inject,
because there's lots of different options of medication.
So many. Yeah. And the portal covers, IVF, and it covers everything. So many different medications depending on the treatment someone's having. You pick the medication, and the video tells you step by step from taking the needle out of the box to how you get the
open it.
Yeah, everything.
How you take the lid off.
Yeah, just open it. And then they have this like a little cushion where it obviously emulates your tummy, and it shows you how to inject. So started that. I truly did think that I was going to be able to get somebody else to do it for me.
How long did it take you to do the first injection to like just get the courage up to do it, because it does. Like the first one is just, it's like mind over matter.
Yeah.
You're like, I'm gonna do it. I'm gonna do it.
Do you know what I remember? I was actually in my aunt's house. I was in my aunt's house that night. She's like a second mum, and I was like, Dolores, like, I just will you do it? And she was like, no, you need to do it yourself.
Yeah, because you're gonna have to do it. Yeah,
exactly. So she was there, and I was like, you can't watch me. If you watch me, I'm gonna stall, or I'll break the needle, or anyway. So I went down to the toilet, and I literally just like, what worked really well for me is focusing on my breathing. So I did a lot of deep breaths, and then I just kept deep breathing. And as I was doing it, before I knew it, the needle was in, and then I was just like pressing it down. So really, once I got over kind of like the fright and I went to do it, less than 2 minutes. Okay. Like, no word of a lie. And I'm terrified of needles.
Yeah.
And then each evening, I'm not going to lie, I did the same process. Freaked out, deep breathing, did the needle, done. So all in all, like, I set a reminder, because you have to do it at the same time every evening. So a reminder went off at 7:30 p.m. every single evening to go to the fridge, because you keep all your needles in the fridge. And by 7:45 every evening, I was done and back sitting down. So, super, super easy process.
And did you find them painful, like, actually, once you did them?
No, do you know what? Actually, I found, but this is just probably me being mad, is that once I was injecting on the right-hand side of my tummy, it was absolutely fine. And one night, which was the second night, I said, well, I injected on the right last night, I'll inject on the left tonight. And I actually found that so much sorer. So I never injected on the left side again.
It's weird. Are you right-handed?
Yeah.
Maybe it's something to do with like the kind of angle it went in at, if you were doing it with it,
Yeah,
weird.
maybe. But don't say you have a male and female side of your brain?
Yeah, and it could have just been...
Men don't have a pain threshold, so maybe it was the male side.
I think some people would disagree with that,
but it was, it was, and I did it. Do you know what? On that night, you have to, obviously, I was 150 units, so like, then when I pressed it down, it got down to 25, and you have to keep going till it's 0. So I did have to re-inject to get the other 25 back in. So I probably was maybe just been a bit clumsy, but that was one night out of the 10 nights that I injected, and every other night it was so fine. I don't have a fear of pain. It's something breaking my skin, and there was no pain, and it was so quick, and I would do it again. I would do the whole process again tomorrow. Like, there was no stress with it at all.
Okay, so once you had gone through this, was it 10 days in total of injections?
Yeah, I did it. I injected from New Year's Eve, which was the Friday, right up until the Monday week was my last injection. So roughly about 10 days.
And during that time, how many times did you actually have to physically come back to the clinic to, have a scan? Yeah,
so I had a scan before I started the medication, just to make sure that everything was okay. And then once I started the medication, I came back a week later just to see how everything was going. So that was one scan again. And then they were trying to decide whether I would have my collection done on the following Wednesday or Friday, depending on how everything was going. But it was just going really, really well. There was a lot of follicles in my left ovary. So they brought me back in for a second scan on the Monday, and still weren't sure whether it would be the Wednesday or Friday, but pretty confident it would be the Wednesday. And then once they saw the scan on the Monday, they were like, you are coming in on Wednesday.
Yeah, because they have to be careful not to overstimulate and to not wait for too long, and then things have just kind of gone a bit...
Too many.
Yeah.
But you can feel it, because obviously the more that you're stimulating the area, the more follicles that are growing, you can feel it. Like, you're a little bit bloated, you at the end of the day, like, the follicles are getting quite large. So like, you can feel the weight of that on your ovaries, and not that it's uncomfortable, it's not sore. I don't mean that in any way, but you can feel there's something going on in your body.
I saw you on the Monday, and you definitely could feel it. And you've said to me that you felt it more on one side than the other. Like, you can feel it. Like, a lot of people in their normal cycle might be able to feel like which side they're ovulating from, so you can feel when things are like moving and growing. And if you think about a normal cycle as like you're growing one mature egg, and you're potentially growing 10, 20, 30, of course you're going to feel it.
It's crazy. Yeah, it's crazy what your body can do and what you can stimulate. Like, I just find the whole process so fascinating. But like, I remember for that scan on the Monday in particularly, that was the scan you were with me for on the Monday. Do you remember when the nurse was looking at the right ovary, and she was like, oh yeah, there's a few. And then she went over to the left, and she was like, wow, okay, there's a lot there. Yeah, we're definitely going to bring you in on the Wednesday. and I had said I could feel it so much on my left side. Again, I just found it so fascinating that one can respond more, you know, and you can feel what's happening in your body. But again, it's important to say it wasn't sore. You know, it wasn't like it wasn't affecting me at all, but you can just feel what's happening in your body.
So when they decided it was going to be on the Wednesday that you'd have the egg collection, you had to take a trigger injection, so your final injection. And when did you take that?
That was on the Monday night, so the trigger definitely triggered me. So I guess just to say, I know a few people who have had this process done, and everybody has different experiences. And some of the girls that I know that had it done, they really felt the medication, because like, remember, you're injecting yourself with hormones every single night. So many of the girls that I know, they kind of felt quite hormonal, like with the hormonal medication. I was lucky enough, I didn't feel any different. It didn't affect me in the slightest, except for 15 minutes at 7:30 every night. And then the Monday, they said...
Until the trigger.
And
then you were like, what the hell is happening to me?
I was mental. And so they say you have to, it's exactly 36 hours from trigger to collection. So it literally just gets everything going. And that was on the Monday night. So the Tuesday I woke up, I was fine, absolutely grand. And then around lunchtime, I started to feel a little bit like, whoa, I'm getting a little bit hot flushes and a little bit dizzy. And then I felt nauseous. And great thing, again, bringing it back to the portal and the nursing team. Straight away, I contacted the nurses. I said, this is how I'm feeling today. Is this normal? Within 5 minutes, I had a response back saying, absolutely 100% normal. Your body now thinks you're pregnant. So for that reason, it's the same symptoms in the sense that, like, you know, you can feel a little bit nauseous, or, you know, you might get a little bit flustered.
Just don't feel like yourself.
Exactly. Yeah. And so I really felt it. Like, I felt like there was a lot going on. But once you know something's normal, you don't mind, you know.
Yeah, because you're like, okay, I'm expecting this. Yeah.
Exactly. So, they triggered everything. And then that was on the Tuesday, and my collection was on the Wednesday. So I was booked in for 10:15 on the Wednesday morning, and that, like, I was gone back out by 2:00. Like, that, the whole process, that in itself was so easy.
Do you remember anything about the actual egg collection?
Well, I guess the process, like, so just to anybody that's thinking of having it done, like, I went in at 10:15, they did my weight, they did my blood pressure, things like that. And I was brought in then for the collection at 11:00. So when you're brought in, there's like about 3 people around you. You've got your doctor and your 2 nurses, and they do your blood pressure. They put like a bung in your arm to give you medication, and they kind of hold your legs in place, because so, like, you know, nothing's moving or anything. And the medication that they give you, you are awake for this procedure, okay? So you're not gone under full anesthetic, but you are given medication to kind of make you a little bit, like, you know, relaxed, and, you know, it's a strong painkiller. So that medication, what I hear, kind of wipes your memories a little bit in a good way.
Yeah, I think it prevents you from laying down like short-term memories.
Yeah.
So anything that kind of happens in that time, you're kind of you're aware for it, but you don't remember it.
Yeah, which is gas. Which is like, I was so worried afterwards, because I was
what did I say?
I literally was saying to you guys, I was like, oh my god, what did I say? Having it done. The only thing I do remember, and a lot of the doctors say, is that you can release a lot of emotions when you're having it done.
Yeah, a lot of people cry during it. It's very, very normal.
I definitely cried. I remember flashes of crying, but not like just emotional crying, and that's it.
Yeah,
that's all I remember. Then I woke up in the recovery area and wanted to go to sleep, which I did.
Yeah. How did you feel afterwards? Were you sore? Because it is obviously, you know, you're putting your body through a lot. Yeah. So how did you feel in the kind of days after? So
that day I went back, I went home, and I was very tired, very, very tired. So like, I kind of was very drowsy, and I slept a lot like that night. I was kind of in and out of it that night. And then I woke up on the Thursday, and I was quite sore on the Thursday. So I would advise anybody, just book the day.
Definitely
off,
take
it off, because like, your body has gone through so much. So I was very, very tender, like to kind of sit. I was so bloated, like super, super, super bloated. You know, like, again, you've a lot of hormones. So like, my boobs were really sore. I wasn't so emotional on that day, but definitely I was quite tender, like, you know, and getting kind of cramps and kind of waves of cramps. But like, again, talking to some people, like they could go through an egg collection and maybe get like 3 eggs or 4 eggs. The medication, everything worked so well with me that they took 17 eggs.
That's a huge number.
Huge number. And they froze 16 of my eggs.
That's amazing.
So you can only imagine how much work was done inside. So no wonder I was like, it makes complete sense that obviously I could really feel it. Yeah. But again, really positive results. So happy days.
Are you really happy with that number?
Oh, I can't get over it.
Yeah.
When I talk to other people, and like, everybody's journey is different, and it's a sensitive topic because, you know, not everybody might get that amount of eggs, and a lot of people could do this 2, 3, 4, 5 times.
I have so many friends who've done this multiple times, and it's really hard when you get like a really low number,
of course,
and it is so individualized, like what you're gonna get.
Exactly, like, and that's why it's like, I kind of like, I'm really happy with it, but I also said that without being like, oh, like that's great, like I understand it is quite sensitive for some people, but I had a really good result, and then again really tender on the Thursday. And one thing definitely everybody should know is that it's so normal then to experience completely different emotions. You know, you spend 10 days injecting hormones into your body, and then that gorgeous trigger medication, you know, and all that medication and hormones have to leave your body. So, you know, you do go through a process where, you know, your emotions can be up and down, quite lethargic, like, you know, a little bit tired. And then you get like almost the same as like period pains. So like you do get like pains in kind of the lower abdomen around the ovaries. But I was back to work on the Friday, happily back to work. Like, that today's Monday, so this is what, 4 days ago, like 4 or 5 days ago, and I feel perfect, like, you know, as in I'm full of beans, you know. So again, you know, let's be aware that it's normal for the medication to leave your body, that you do feel emotional with it. Be ready for some pains. Nothing that Solpadeine isn't going to sort out. There's nothing that's going to stop you driving or doing anything. Just give yourself 24 hours after the procedure, and it's absolutely perfect.
And just mind yourself, because, you know, some people might take a bit longer, and some people may want less time. You know, it depends.
Some of my mates, they were back to work the next day, and then I have other ladies that I know that were 4 days recovering afterwards, that they just needed to take a little bit extra time. Everybody's different, like just listen to your body.
So you're really happy with the outcome, and let me ask you this: would you do it again, and are you planning on doing it again?
Would I do it again? Yes, tomorrow. Like, the procedure was so easy, honest to God. It was absolutely so seamless and streamlined. But when will I do it again? I think before the end of 2022, I will do it again. And the reason that I will do it again is, when you have, let's say you collect 5 eggs or 3 eggs or 30 eggs, you know, they're what would you say? Like, you have your best, your second best, your third best, your fourth best. So even if you have 20 eggs or 4 eggs, you still have a first, second, third, fourth. So I believe it's a good idea to do it a second time anyway. So you have 2 bests. You have 2 second best, you know, 2 thirds. So I personally will definitely do it again. But I have no need to think that I need to do it anytime soon. I got 16 eggs. I'm very lucky. I will do it again just for peace of mind before the end of the year.
Amazing. We have some questions that people have sent in. We asked on our social channels if anyone had any questions they wanted to ask you personally. As I said, it's like there's nothing better than getting to actually ask someone who's been through it. So one of the questions that we got a lot of was, did it hurt? Which is, you know, something we've talked about. But yeah, what part hurt?
If I was to generalize that answer, I have to say no. Okay, but there's some form of uncomfortableness. So the procedure itself, as I said, I had very strong painkillers in me. I do not remember the procedure. So the answer to did it hurt with the procedure, I have to say no, because I don't remember feeling the procedure.
It probably did hurt, but you don't remember.
Exactly. I don't remember feeling it at all. That evening on the Wednesday, you know, I was slightly tender, but I was in and out of sleep. So the biggest thing for me was the day after, where I was very bloated, I was sore, I was a little bit tender to sit down. But again, if you forecast to have that day of rest and just like watch movies, read a book, just chill out, that's it, you know. So it didn't hurt, but there's definitely an element of kind of tenderness after the treatment.
It's not comfortable at points, I'm sure. You know, no one wants to be injecting themselves. You know.
Oh, the injections, no. Like, as in, one thing, anybody who's worried about the injections, do they hurt? No. Absolutely not. They are so thin. I was so worried about them, but then
you can hardly see the needles. They're tiny.
They're so thin. No, the injections are fine. The procedure I don't remember, and the day after I was tender. Honest to God.
Okay, amazing. Someone wanted to know, is it actually Dr. Kennedy who does the egg collection?
Yes, Dr. Kennedy did my egg collection. I was so happy to see a friendly face there. So yeah, Dr. Kennedy does the egg collection, and how lucky are we to say that Dr. Kennedy is doing the egg collection, the best fertility doctor in Ireland.
He's amazing, isn't
he?
He's
amazing.
Okay.
Personally and professionally, he's just a really good guy.
He is. Is this your first egg collection procedure?
This is my first egg collection.
But it won't be your last.
It won't be my last. I'll definitely go a second time.
Okay, someone else wants to know, how long did the process take from your first consultation to end result?
So first consultation, I booked in 4 months later. And then from starting the medication, it was 10 days.
Okay, cool. Yeah, there's a lot of, is it sore? Is it sore? Does it hurt? I think that's something that kind of puts people off.
Yeah, no need, honestly. But I can't say I don't understand the questions, because I was terrified. Yeah. You know, I definitely was terrified. But the biggest saving grace to me was the portal. Like, I used to, I still do. And I know they probably said I was probably like a nightmare client, because I was just like, is this normal? Am I going to feel this? But I used the nurses, you know, their information and their care as much as I could to put my own mind at ease. Yeah. And they were just always there to just calm you, so there's nothing to worry about.
Okay. Another question is, what would you say to someone who is thinking about getting their eggs frozen?
I would say don't think, do. You know, and it really is like there's not enough awareness, and I hope that and I love that you're doing the podcast, and I love that Therapie Fertility is just really getting the awareness out there. I really, really strongly advise anybody who's thinking of it, just research it and, go for your consultation and then make your own decision. But don't sit there and think about it, because unfortunately, and I hate saying this because the reason I got it done was for this reason, time isn't a luxury for somebody in their early 30s, and you shouldn't, mid 30s, late 30s, whatever age you're at, you shouldn't have to feel pressured. So for such a quick, easy procedure that takes the clock away, takes the pressure away, gives you reassurance, peace of mind, why would you think about it and say, oh, that's something I'd love to do? And then you're still saying that in 3 years when you've depleted your eggs, you've depleted the quality. It just doesn't make sense to think about it. If you're thinking about it, there's a reason for it. So have the consultation and just do it, because there's no downside, there's no negatives, and you don't ever have to use them if you don't want to, but they're always there if you do.
Yeah, for sure. Okay, final question. Are you happy with your decision to get your eggs frozen?
I'm more than happy to the point that, as I said, I would happily have this done again in the morning, and I will have this done again before the end of the year. And I do count myself extremely lucky for the number of eggs that I got, but regardless of how many I collected or I got collected, the fact that I've done this now, I can't express. I have my treatment, my procedure on the Wednesday, so I had the collection on the Wednesday. Take away the emotional and the tenderness on the Thursday. The actual release as a person that I felt on that Thursday, going, oh my God, it's done. I don't have to worry about having to make this decision or feel pressured or, or just having to worry. I will have kids. I want to have kids. I'm kids obsessed, but I don't want to have them right now. Mm-hmm. I'm sick of that clock counting down. And now, for the first time in my 30s, and which will be for a good few more years of my 30s, I'm just live life, enjoy it. I'm so happy to get to live my life the way I want to now, and know that I can use those eggs if and when I want to at any time.
Amazing. Well, thank you so much for sharing your story, and it's been a pleasure to chat.
Thanks for having me.
We hope you've enjoyed this episode of Fertility Talks, the Thérapie Fertility podcast. If you have, please rate, review, and subscribe. For more information on the services we offer, you can visit www.therapiefertility.com.